Good afternoon and welcome to our daily briefing. These certainly are challenging times that we're dealing with, but it's been especially hard for our seniors who are more vulnerable to the virus and must take extra precautions to avoid exposing themselves to COVID-19. As this lockdown continues, we know it can be difficult for seniors who may not have nearby family or friends to help. That's why today we want to talk about the resources that are available to our older adult population. The county's Aging and Independent Services Office, or AIS, has always been there to help seniors, but they have really stepped up their efforts during this crisis. Aging and Independent Services provides meals to those 60 and older with the greatest economic need. Its partners have increased the average number of daily meals served to seniors and homebound adults by 92% over the last 3 weeks. Through additional delivery routes and new volunteer staff, senior nutrition providers have nearly doubled the amount of daily home delivered meals throughout San Diego County. All eligible seniors that were previously attending a congregate dining site now have the opportunity to pick up a to-go meal or are receiving a home delivered meal to ensure continued access to food. Excuse me. To be connected to this service, you can call 1-800-339-4661. Again, that number is 1-800-339-4661. Our Aging and Independent Services Department has many nutritional partners throughout the region doing excellent work to feed the vulnerable members of our community. One great example are the 13 community emergency response teams, or CERT teams as they're called, who are volunteers from around the county of San Diego that have assisted Feeding San Diego and the San Diego Food Bank with 4 large-scale food distribution events. This partnership resulted in over 3,700 families in need receiving food during these events. It is also important for older adults to remain connected and active. The County Live Well at Home webpage has a link specifically for seniors and older adults, which offers our popular Feeling Fit videos and exercise program for older adults that you can do at home even if you have limited mobility. That page also has Tai Chi instruction videos and a link to the San Diego Oasis, which offers a morning meditations with Mary class on Tuesdays and Thursday mornings to practice mindfulness and connection. To find all this, go to livewellsd.org, or if you need help accessing any service, dial 211 to get connected to resources in your area. Lastly, we know that times of crisis can bring out the best in people, but we also know it can also bring out the worst in people. And if you or someone you know is a victim of elder abuse, we urge you to contact Adult Protective Services at 1-800-339-4661, 24 hours a day, 7 days a week. Again, that number is 1-800-339-4661. With that, we'll get right into the information for today. Supervisor Fletcher will start off with an update on the numbers. He'll be followed by Dr. Eric McDonald, our medical director of the county epidemiology, I'll get it out, and immunization branch for the medical update. So Supervisor Fletcher, please take over.
Thank you, Supervisor Cox. In addition to the resources that are available via the county and via our incredible nonprofit partners for seniors, we want to take this moment to ask every San Diegan to reach out to a senior citizen in their life who they know and check on them. It could be a family member, it could be a coworker, it could be someone you know, but if each and every one of us would simply make a phone call to one senior citizen who we know to see how they're doing, to see if there's anything they need, to give them some encouragement, some support, some help, maybe connect them to some of the services we've just shared, and make sure that they are doing okay. We as a community can continue to remain strong. The burden that we bear on our seniors is obviously much greater. They've been asked to go into a different level of quarantine. They were asked to do it earlier. There also is more danger to our senior citizens in the dangers surrounding coronavirus, and that could create a much greater sense of anxiety and uncertainty. And so the simple act of each and every one of us personally reaching out to someone that we know and offering them some help and assistance would certainly go a long way and be greatly appreciated. Before we get into the numbers for today, a quick update. Tomorrow, the San Diego County Board of Supervisors will convene our regular meeting remotely. While non-essential functions of the county have changed, our county government remains open, and those essential services continue to be provided to the people of San Diego. In addition to several items on our regular agenda, there's two agenda items I would like to highlight for you. The first is in coordination with Supervisor Cox. He and I will be bringing forward a behavioral health impact fund. This is a program we've been working on for many, many months prior to the coronavirus outbreak with Mayor Faulkner and with the city of San Diego. It is essentially taking $25 million that is tied up presently in a lawsuit around redevelopment, distribution, and allocation of funding, and both the city and the county agreeing the dollar amount in dispute between the two of us, the $25 million, is money that, regardless of who might win the lawsuit, ought to go to increase our availability of behavioral health services. If approved by the Board of Supervisors tomorrow, the $25 million will be available and will be out there for service providers, folks who provide drug treatment, alcohol treatment, or mental health services, who have the ability to acquire a building, renovate a building, expand a building, and can demonstrate an ongoing services that we would make a one-time capital investment to try and bring these services online. Given the duration and the lasting impacts of coronavirus, this is incredibly timely now, in that it could provide an opportunity to provide an increased level of services at a time when there may be some facilities, particularly motel services, that may be available. So keep an eye out for that. In addition to the Behavioral Health Impact Fund, tomorrow our County Board of Supervisors will be considering appropriating more than $500,000 in direct contributions to nonprofits that are ensuring food security for San Diego County residents in need. So those are two important actions that we will be considering tomorrow. A quick update on our pledge. We've really seen a tremendous community response from that. More than 10,000 San Diegans have taken the pledge, again, really stressing the vital importance that the month of April presents us and the real commitment we need in the month of April. While we don't have current baseball games on TV, it was great to see the San Diego Friar with an appropriate face covering there, not a medical mask, not a surgical mask, a very creative face covering there. Take the pledge and share. Again, if you go to coronavirus-sd.com/pledge, this is just an affirmative statement that each and every one of us can make to adhere to the guidance and the suggestions that have been put forward. Real quick, before we get into the numbers and the charts for today, we've been asked a number of times in the preceding days if we could provide racial breakdowns for positive COVID cases in San Diego County. The team here has worked hard, starting at 5:30 p.m. today, when our website updates with our chart of what was previously breakdowns by age. We will be including racial data for positive COVID cases. I want to preview you what will be on the website today, but I want to put in context that as of yesterday's number, which is what we will see, 1,326, that was yesterday, we're going to have an update. But out of those, 27% of those, 358, the test results had no accompanying racial demographic data. And so we are not able to determine what they are because the folks who submitted the testing, it was not on there. Out of the remaining ones that did have it, 51% are white, 29% of the positives are Latino, 18% of the positives are Asian, 6% are African American, and 3% are others. This tracks very closely with the broader demographics of San Diego County, but we will begin producing that information on a daily basis in the evenings when our website updates, and we'll continue to keep you apprised of those. Let's jump into our cases by date reported. For yesterday's total, or the total for today, I'm sorry, you'll see an increase of 78 cases, brings us to 1,404 total confirmed positive cases in San Diego County. Our test results, as reported currently, 827. Again, you tend to see these results batched in large batches, and so not a lot to read into the day-to-day totals, but we know that the efforts to increase that continue. The breakdowns in total tests, we're now at 18,490 total tests that have been reported to us, with 1,404 positives, maintaining about the same percentages that we saw yesterday in the percentages of total tests versus positive tests. Next chart breaks down the positives, hospitalizations, ICUs, and the unfortunate loss of life. Again, we're still seeing in most of these a doubling somewhere between 5.2 and 5.6, 5.7, depending upon the category that you look at. COVID-19 outreach efforts, our numbers are up. Nursing triage line up, EpiCalls, hygiene kits, hand washing stations, number of toilets distributed remains static. As we get more requests, we will fulfill those. Update on motel rooms that are available. We're doing increased outreach with our healthcare system partners to ensure that they know that for every positive individual or PUI who does not feel comfortable going to their home to either quarantine or isolate depending upon their circumstance, that those rooms are available. And we continue to work with the Regional Task Force on Homeless on the role that those rooms play in the regional response to homelessness. Increases across the board in personal protective gear. We're now at more than 1.7 million individual items of personal protective equipment have been provided to our health system partners. And the final chart here, ventilators. All 23 of 23 hospital systems are reporting today. As of presently, we have 537 available ventilators throughout San Diego County. And again, this is not the total number of ventilators. This is the total number of ventilators not presently being used. As it is every day we report, slight uptick in the ones we have on the county who are ready to deploy. And again, we are awaiting arrival of the 125 we have ordered, and we are awaiting an update from the state of California on the 600 that we have requested from them. And that concludes my portion of the report. I'll now turn it over to Dr. Eric McDonald. Thank you.
Thank you, Supervisor Fletcher, and good afternoon, everyone. Globally today, there are just under 1,325,000 positive cases worldwide, which includes almost 74,000 deaths. Nationwide, 352,346 positive cases have been reported, along with 10,389 deaths. As a reminder, the United States has the largest number of cases that are reported of any country in the world. In California, there are 15,207 positive cases that have been reported as of to date, and this includes 351 deaths. As the supervisor mentioned, the County of San Diego is reporting 1,404 cases, which includes a total of 19 deaths, which is unchanged from yesterday. And I think it's important to state that deaths are a lagging indicator in an outbreak. This is true of flu, it's true of COVID-19. We learn about cases when they're reported because of lab results, but we often don't learn about deaths until a report is filed. That can sometimes be delayed and sometimes be incomplete and sometimes not be matched to a lab result. That takes time. So as is typical with really all reported communicable diseases, particularly with this number, it is a lagging indicator, and the fact that that number hasn't gone up in a couple of days should not indicate anything in particular. Of the 1,404 cases, which is 78 more than the day before, 799 or 56% were between the ages of 20 and 49. 739 or 53% are male. 269 or 19% have been hospitalized, and this hospitalization number includes 102 or approximately 7% of the total of individuals who are admitted to the intensive care unit. And lastly, the 19 deaths represent 1.4% of the total number of cases. And those percentages locally are very consistent with the numbers being reported at the state and the national levels. To the families and friends and loved ones of those who have been lost to COVID-19, I want to extend my personal and on behalf of the county, our sincerest sympathies and condolences. Regarding outbreaks in congregate and community settings. There are no new outbreaks to report today, and the cumulative total of 17 confirmed outbreaks. 11 congregate facilities represented 87 cases, and 6 community setting cases represent 28 cases. Once more, I'd like to thank the individuals, organizations, businesses, and governments for all that you're doing to adhere to the state and local orders and recommendations. All of these actions are, in fact, we know, bending the curve and will save lives, and we thank you for that. And back to Supervisor Cox.
Thank you, Dr. McDonald. We'll go straight to the questions again. If you're not identified by your name and your outlet when you're introduced, please do so before you ask your question. Let's take the first call.
KUSI, please state your name and question.
Hi, this is Hunter Sowards with KUSI. We have been receiving some information from viewers suggesting that they were actually denied entry into some essential businesses because they were not covering their face. While this is still a suggestion for the public, if Dr. McDonald or Supervisor Fletcher could just speak to if that is, I guess, correct protocol for those businesses.
Okay, Supervisor Fletcher, I believe, is going to answer that question.
Thank you, Supervisor Cox. The order as given, the public health order as given, is for grocery stores, restaurants, convenience stores, gas stations, and pharmacies, that the employees in those facilities shall have a mask and shall wear a mask when they are at work. The guidance around the general public is a strong recommendation that the general public have a face covering. Again, it's for a face covering for the employees. It's required for the employees of those establishments only. But there is a broader health order of a face covering recommendation for all individuals when they leave their homes. If an individual business chooses to say that you need to have a face covering to come into their business, that is a determination that those businesses can make. But again, for the employees of those 5 entities, they must wear a face covering as a part of their work. But we are strongly recommending and encouraging all San Diegans, anytime they leave their home, to have a face covering. And so that would be an individual choice of the businesses if they wanted to limit the entrance to individuals with face coverings.
Thank you.
Okay, let's go to the next question.
NBC 7, please state your name and question.
Hi, Allison Ash from NBC 7. So we have learned that someone at the EOC tested positive for COVID-19 and that other EOC employees have been told to keep reporting to work and not quarantine if they actually are showing symptoms. Is that in line with the guidance that the county is giving the public, number one? And number two, have all personnel working in the building been notified, or only those who had direct contact with that individual employee?
Dr. McDonald answered that question.
Yeah, thank you for that question. I think that there might be a little confusion on the facts on this issue. There was a notification to employees about a single case of COVID-19, and the EOC employees, like many employees across the county, and in healthcare and in other essential services, have been given consistent advice, which is that if you have symptoms, stay home. If you've been exposed and your workplace determines that you are essential to operations, which frankly everyone in the EOC is, that they should report to work with self-monitoring, that is, getting your temperature taken at least twice a day, and if any signs and symptoms occur, that they should exit immediately and stay at home. So there's a little terminology in your question that is a little off. You don't quarantine when you have symptoms. That's isolation. You actually quarantine if only you are exposed, and that is good advice to individuals who are not in an essential job. But for healthcare workers, and specifically for workers here, the advice that has been given is to be self-monitoring and not to quarantine. Is there a follow-up?
Have all personnel working in the building been notified?
Well, actually, we work in a number of different buildings. We have socially distanced as much as we can here, and normally, if it was an earthquake, we'd all be together in one building, but we're actually in multiple different buildings. The individuals who had the specific need to be notified because of this case were notified.
Okay, let's go to the next question.
Caller, please state your name, outlet, and your question.
Hi, this is Will Hunsberry from Voice of San Diego. So you guys showed us modeling a week and a half ago or so that showed what would happen with no social distancing measures and how our health systems would be quickly overwhelmed, and what you think is happening now. And it showed that, you know, our healthcare capacity may be overstretched even in 4 weeks when we hit the peak. But you said that modeling was very simplified, and you know, you've told us that you're working on more complex modeling. And so what is that modeling telling you, and why aren't we seeing it in the public?
Okay, Supervisor Fletcher will answer that question.
I realize it can be frustrating to exist in an environment where the simple reality is we don't have enough reliable data to point us to a specific modeling that we have confidence in the underlying basis of to be accurate. And that is as frustrating to all of us as it is to all of you. It's also as frustrating to us in San Diego County as it is to our friends in Los Angeles County and Orange County and the state of California and the state of New York and the United States, and I suspect as frustrating as it is to everyone in all of the other worlds and jurisdictions that are dealing with this. But the simple reality is, because of limitations of testing, because of how quickly this is evolving and changing, we don't yet have a great set of data upon which we can come out to you and tell you that based on what we know today, this is the point at which this will happen and this will be needed. We do continue to meet with experts from around the country and from around California, and they continue to give us information and data that varies wildly based on which entity you're talking to. And so at the point at which we have something that we believe has a level of basis in underlying data from San Diego, and that we think that it is giving us an accurate or semi-accurate guide of where we should go, we will absolutely share that. In the meantime, what we know is physical distancing will work. We know that things like face coverings are something that have been added to the listing of what we're sharing. We also know that everything that we can do to increase the capacity of our healthcare system, whether it is more ICU beds, more hospital beds, more ventilators, more doctors and nurses and healthcare staff in our Reserve Medical Corps, we know that all of those things are the things that we need to do to flatten the curve and raise the bar. And when we get to a point where we feel like we have data that has a sufficient basis in something that is accurate, then we will share that and present that. In the meantime, what we all have to do is what we know works. Efforts to flatten the curve, efforts to raise the bar, and every day that goes by, we hope that we have more data and more testing that can point us into more specific data. And so I recognize that it is a frustration that we can't put a chart up in front of you to tell you exactly at this day we will need exactly this number of that thing. But the simple reality is that doesn't exist. And so we cannot give you something that does not exist. But when it does, trust us, the public in San Diego will be the first to know. Thanks.
So I wonder, I mean, you know, it wouldn't even have to necessarily be something that says exactly when everything is going to hit its peak. I mean, I think we as the public understand that maybe that's not available, but, you know, maybe some kind of best and worst case scenarios. I mean, you guys had just said that the modeling was very simplified the first time. And so, you know, is there any chance of modeling that will give us best and worst case scenarios? And if not, are we still on track for what the last model told us?
Well, the last
that
model,
our healthcare system would be overwhelmed in 4 weeks from now.
well, the the chart and the information that was shared with you initially at that point was to demonstrate the impact and the importance of physical distancing. It was to demonstrate the impact of a doubling every 3 days and what that would look like versus a doubling every 6 days and what that would look like. And so it was really to drive home the point of the vital importance of what we're doing. The further that we push out that date by which the health system capacity is overwhelmed, the more time it gives us to increase the capacity of our healthcare system. The more time it gives us to acquire more ventilators. The more time it gives us to set up mobile field hospitals. The more time it gives our hospitals to reconfigure and reimagine what they're doing. And so that situation continues to change. The best case scenario is we will hit an apex and a point under our health system capacity. The worst case scenario is we do not. And so we will continue to press ahead and look for more options. There's a number of these tools that are out there. Folks can plug in the numbers in their jurisdiction and get a sense of where it is. But we are moving as rapidly as we can with the data we presently have to run those models. But again, what we know for a fact are that the action steps that we can take now, irrespective of data, which is that we have to flatten the curve, we have to raise the bar, and everything that we do every single day are designed to do those things. And whether you look at one university's model or another system's model, those two facts remain true, and those are the things that continue to guide our daily efforts.
Okay.
Okay, that completes our phone-in calls. We're going to go down to the texted questions, and the first two are going to be responded to by Dr. McDonald.
Thank you, Chairman Cox. This one is from Angela Torres. Is there a connection between young people infected with COVID-19 and illegal drug use or abuse? Do we have any numbers that reflect that connection?
Well, fortunately, we don't have very many young people in San Diego who have died of COVID-19 or have been hospitalized. Those numbers are small enough that I wouldn't make any speculations about what their underlying conditions are. And I'm not aware that someone specifically looked at that question at a national level, but I think it's a good question. I think it's well known that drug use affects overall health, and certainly underlying conditions of multiple types increase your risk for bad outcomes from COVID-19. So I think it's natural to make those connections and think that that might place you at a higher risk, but we would have to look at the data to see if that's true.
And I have a cruise-related question. Another passenger from the Celebrity Eclipse has been transported to a local hospital. Has that person tested positive for coronavirus? And how will these patients aboard the ship impact our capacity to handle COVID patients?
Well, let me take the first part, or the last part first, and that is that we're working very hard to be sure that any healthcare needs for those on the ship are being taken care of on the ship. That is the responsibility of the cruise ship companies. They have medical departments. They have gotten resupply. We've made sure they've gotten resupply, and in fact have made sure that they have the proper PPE on board so that they have good infection control. And at this time, the number of cases that are coming off the ship is not significantly impacting overall capacity in San Diego. There are occasionally patients who are evacuated from the ships. We have 3 ships that are coming in and out of port. People can see them coming in and out, getting replenished. There was one patient evacuated overnight who was actually returned to the ship this morning, and just this afternoon another patient was evacuated from one of the other ships. Really, I would direct you to the cruise ship companies to get details about that, but remember, these are individual cases that have privacy rights, frankly, and the details of those really are not germane to the public.
And the other part of that question is, are those numbers included in our updates in our countywide planning and care?
That's a great question. The cases themselves are not counted in the cases that we report in our statistics here in San Diego County because they are not San Diego County residents. Cases from who are on cruise ships, they are actually not in San Diego County. Actually, they're not even in the country. And so the cases that are reported there actually are routed through the CDC, and the CDC maintains a separate listing of cases that are associated with cruise ship COVID instances. And so I would direct you to them to get specific answers on those questions. The number of cases, again, is low enough that that's not really a significant factor in our larger planning. The number of passengers who are on these 3 ships is down to less than 10. There's specific individuals who are having difficulty being entered back into their own countries and also cannot enter the United States. And the other members of those ships are actually all crew members.
And I have a question from Paul Sisson with the Union Tribune. How many local COVID patients are currently hospitalized, and when will the county begin sharing the daily COVID census with the public?
That's a great question. I don't have the answer to that because we don't follow that day to day in the epidemiology program. It's not a meaningful statistic for us to follow. The most important statistic to follow is the number of people in the hospital total, and that, of course, is followed day to day by our emergency medical services. Breaking out which % of those or what actual number of those are COVID-19 patients, again, doesn't really help us with overall capacity because people in the hospital are in the hospital. Some of their needs might be different, and again, we follow the supply needs as a separate issue. And we in epidemiology, frankly, are very challenged by the number of cases that are coming in, and we're spending most of our epidemiology effort on working with cases that are identified, understanding their locations that they're coming from, and the infection control responses, public health direction that might need to come from each individual case. Following specifically the number of COVID cases in the hospital really doesn't help us with our public health management. We do recognize that members of the public, including yourself, are interested in this, and we will eventually be able to report that as a number, but that's not the highest priority at this time.
All right. Thank you, Dr. McDonald.
This next question deals with protective equipment in the work environment, and Supervisor Nathan Fletcher will answer that question.
Yes, I believe we've touched on this. Steve Price is looking for a little clarification from Channel 8. We are getting emails from workers at essential businesses concerned about their work environment. Who is supposed to provide them with masks? Are the employers responsible for providing masks and gloves? And are employees supposed to provide their own? What do you want to say to employers about their responsibility to create a safe work environment?
Well, first, I just want to reiterate the order. We have a strong recommendation for all San Diegans when they leave their home, whether it's to go to an essential business or to go to an essential service like a grocery store or a medical appointment, a strong recommendation that they use a face covering. As it relates to essential businesses, we've only outlined 5 categories of essential businesses where it is required that the employees in those businesses wear a mask. And again, those are grocery stores, restaurants, convenience stores, gas stations, and pharmacies. For those 5 entities where it is required that the employees have a face covering, it is the responsibility of the employer to ensure compliance with that order. Now, the employer can do it collaboratively with their employees. If people can provide their own, that's great. If the employer wants to provide them all, that's great too. But it is ultimately the responsibility of the employer to ensure compliance with the order. Additionally, as folks have concerns that in those 5 entities there are in not compliance, then you can go to 211sandiego.org, and they have a special section featured on their website that gives you both the non-emergency response line for all of the jurisdictions, but also the ability to enter your concern about non-compliance via a web portal that will be received by 211 and routed to the appropriate jurisdiction. So if there are public concerns about non-compliance with health orders, go to 211sandiego.org, and there's an interface there where you can report those concerns, and they'll be routed to the appropriate law enforcement agency.
And this is also related from Claudia from Univision. It's on the same topic. Her question is, what if those supermarkets are not following the social distancing guidelines, and are there citations for them, for groups, and for the businesses?
Well, so we covered face gatherings. Let's talk about physical distancing. All essential businesses that remain open in San Diego County are required to post outside of their location their physical distancing plan. There's a template for that on the county's website. I've seen several businesses that printed out that template, filled it in, and posted it, and they're also supposed to communicate that plan to their employees. If there are entities that are in non-compliance, either with the 5 particular categories that are required for face coverings, or all essential businesses that are required to post and adhere to a physical distancing plan, then again, you could utilize that same resource at 211sandiego.org to either contact the non-emergency line in your jurisdiction or just submit it via the website, and it will be routed to that law enforcement jurisdiction. And then the enforcement of that would be at the discretion and availability of the law enforcement agency for that jurisdiction. And so we would encourage you, as you see concerns or problems, again, to utilize that website to have the concern communicated directly to the relevant law enforcement agency.
The next question we have is dealing with personal protective equipment, or PPEs, and Dr. McDonald is going to start the answer to that question, and I think Rob Sills, our director of the Medical Operations Center, will conclude.
This question is from Charles Clark with the Union Tribune. SEIU 221 unveiled a study today that found frontline county employees do not feel the county is providing adequate access to personal protective equipment, especially N95 respirator masks and eye protection. How do you respond to those concerns, and what does the county's level of supplies actually look like for PPE such as N95 respirator masks, surgical masks, and the like?
Well, thank you for that question, and I haven't seen the specific survey, and I think that as anybody who's done many surveys, either in medicine or outside of medicine, sometimes the way the question is asked and who's being asked the question and who's responding matters, and so I would like to see some depth behind it. But I think one of the most important things is that it's important to know which employee needs which kind of protection. So a healthcare worker, for example, who's involved with a aerosol generating procedure is somebody who needs a face mask and an N95 mask. There are very few individuals in the county employ who actually have that need. There are others who may simply need a face mask when they're interacting at work, and others who just need a covering like I have now. So the devil is in the details of which specific employee needs which specific type of protection, and are they in fact getting that? And so I can't respond specifically to that survey and would like to get the details, but I'll turn it over to Rob to talk about the actual supply question.
If I understand the question correctly, they're asking about the supply of N95 respirators and face shields. If you remember, the PPE kit involves protection for the eyes, whether it be goggles or a face shield, protection for the respiratory system, which is a simple surgical mask or N95 respirator, and then a non-permeable gown and gloves. The county, we're doing okay. I'm optimistic about the number of simple surgical masks and N95 respirators. However, the number of face shields and non-permeable gowns is very low. It's critically low, both in the county and the state. So we're reserving those, and we're keeping those, like Dr. McDonald said, for the healthcare workers that are doing a procedure that could produce an aerosolized response. Thank you.
All right, thank you, Rob. I have another question. This is from Alexander Wynn from KPBS, and I believe Supervisor Cox is going to answer this, Chairman Cox, for us. Imperial County Board of Supervisors gave the county's tax collector the ability to extend the second property tax payment to May 1st. Will San Diego County Board of Supervisors do the same?
We don't believe we have the authority to do that. The tax collector is looking, I think, at each individual case on deferrals and on penalties. So that's the best answer we have for you right now. Next question.
This question is from Justina with Fox 5. These are questions regarding homemaking masks. Are plastic masks like those made from 3D printers as effective as fabric masks? Is one material preferable to another? And how often should we be washing our masks? What is the best way to wash them?
Dr. McDonald will answer that question.
I think that's a great question. Different types of material are likely to have better dispersion reduction than others. I think that what you should be doing is using what you have. And again, you should wear what's comfortable for you and what you have available to wear. And you may find that that changes over time. I think that for the specifics of each different type of cloth and that sort of thing, I would actually refer you to other sources. But I think it is a good question, but it gets back to why we're doing it. We're not doing this in medical environments. This is not a medical protection device. This is a public protection device and recommendation. And really what you're doing is you're protecting others from your own respirations. And again, what you find most comfortable to wear and is probably the most important aspect of it. And then if you can, again, research what you have available to perhaps find what's best for you is what I would recommend. Oh, another question? Oh, I should have taken this off. Sorry. Apologize.
I do have another question from Will Huntsbury. Do we know about all of the COVID-19 deaths, or are there some suspected COVID deaths that aren't included in the official numbers?
Oh, that's a good question, and it gets to my point about the delay. We have had reports since the time that the count was made to produce the report that's on the website. Again, some of those have COVID listed on the death certificate, but yet we don't have a lab report for it. And many of those cases have in fact not turned out to be correct, so we don't list those as probable cases at this time. We really take the 24 to 48 hours to really research this. So there are several cases that are in that category of more research. But I would just ask you to be patient to see what shows up on our daily statistics. I know that this is a world with instantaneous results, and you see things updated on an hourly basis on some of the websites that are compiling information from all over the world. But in real time, in our local health department, it takes time to investigate these. And so I ask you to be patient.
All right, thank you, Dr. McDonald.
That concludes our call-in questions and text questions for today. But as we've done from time to time, I always like to highlight some of the good news of people in our community who are stepping up to help others. In this case, it's a local student robotics team that includes students from the Cambridge School, the Bishop School, Westview High School, Valhalla High School, and Mesa Verde Middle School. They are using 3D printers, and this kind of gets back to a question that was just asked a couple of minutes ago, but they're using 3D printers to make face shields for healthcare workers on the front line of the COVID pandemic. And so far, the team has assembled 300 face shields and began distributing them to healthcare workers with UC San Diego, Sharp, Kaiser Permanente, and Pomerado Hospital. They're not stopping, and they plan to make 600 face shields and have launched a GoFundMe campaign to help fund the project. It's efforts like this that I just think are amazing to see throughout the San Diego County region. We realize that one by one, we will all work together to help fight this virus, and we certainly hope to keep it up. Again, we'll see you tomorrow at 2:30, same time, and remember to live well, stay well, and to stay well, stay home. Thank you.